If you're just joining us, today is the first day you can sign up for health care insurance under the new Covered California. With me this morning is Craig Gusson. He is a health insurance broker to tell us everything you need to know about what is going to be happening to you over the next 90 days at least. Anyway, and first thing we want to bring to people's attention is there's been an issue with computers around the country with people trying to sign up. One of the reasons why you're telling folks, slow down. Don't be so quick.
I mean, that's not surprising to me at all. I think anybody in our business sort of expected this, which is why we're saying, first of all, everything's not out yet that we want to know about to give you all the options. So why jump in today and sign up? There's really no benefit. It doesn't go in effect until January, so we're still 3 months away from you getting coverage.
All right, so A, be patient.
Yes.
Take your time. B, educate yourself, right?
Yes.
Okay, and that's what we've been trying to do. And we've been getting some viewer questions, and I want to put up the first one for you here to answer, and here we go. I have yet to see or hear of any friends or business colleagues whose costs will not go up. Is there anyone who will not see costs go up? And that's from one of our viewers, S. Weber.
The only one I can think of might be somebody in the early to mid 60s, maybe somewhere between 62 to 64. And
that's it?
That's probably, from what I've seen, yes. Unless you're getting a subsidy. Excluding getting a subsidy, I don't see anybody's rates being less.
Isn't the name of this affordable health care?
It is, but unless you, maybe if you go with the $5,000 deductible plan, the bronze plan, and before if you had a much richer plan. But if you want to compare apples and apples and just say, hey, I want similar coverage, what would it cost me? It's going to be more money.
Are you going to be able to keep your same doctor in many of these instances or not?
In Covered California, it depends because the networks are going to be much smaller, but 30% of the doctors in San Diego County will be in the Covered California. The rumors I'm hearing is Sharp or Scripps may not be in the Covered California plans, or one of them may be.
That's huge.
Yes, very huge.
I mean, we're talking hundreds, if not thousands, of doctors.
Exactly.
That are going to be affected by this, and more the patient's not going to be able to get the doctor they've had in the past.
Which is why we keep saying, let's wait a little bit. Let's see what's out there. Let's see what you can buy outside of the exchange versus inside the exchange. Let's get everything out there on the table, and let's be able to make the best decision for you. Because whatever you decide on, you're stuck for a year.
All right. You may be getting a phone call here in the next few days or few weeks or few months saying, hey, have I got a deal for you? There's going to be a lot of fraud out there, isn't there?
That is a major concern I've had for a while, because somebody might call you up and say, David, for $250, we can get you the health insurance and we can do everything for you. And what I tell everybody is anybody who can help you get health insurance is either going to be paid by the insurance company or Covered California. You do not have to pay anybody to help you.
If people are calling you, that's the first sign of maybe something's up, right? Will anybody be calling you?
Unless I get a, I mean, people will call me up. If I'm a consumer, you may have an agent call you up because David Davis said, hey, give so-and-so a call.
Right.
But somebody's calling you up out of the blue, I would really question it. And if you signed up, you got to give that person, regardless if you're in Covered California or through an agent like myself, you're going to give them your social security number and some very personal information. Yeah. You better be aware of who you're giving that information to.
Very careful.
Yeah, I mean, because it's very easy to say to the agent and look up the website and see it's a legitimate person, but you're going to get fly-by-night people, and that's a major concern I have.
They're always taking advantage of these situations, aren't they?
They are,
crooks out there.
and it is.
Final question, a quick one. How do you find the exchanges? What's your first phone call?
The first thing you want to do, and what I think is, trying to go to Covered California and figure out which plan is best for you.
Go to Covered California on their website.
Right. If you do that, it's a lot like saying to your doctor, send me an x-ray and let me look at it and I'll tell you what I want to do. I think you need to talk to somebody who understands the plans and they can walk through it with you, which is why I always recommend deal with an agent. You know, the San Diego Association of Health Underwriters has many really good agents that can help you and walk you through it. And we've had a year and a half, 2 years of education and training to better understand what's out there. And that's a concern I have, because you're going to look at it for 30 seconds or a minute or 5 minutes or an hour, but still not get all the nuances to it, such as, is my doctor in the plan? What's my deductible? So it's very important that you work with somebody who can walk you through it and design a plan that's going to meet your needs price-wise and benefit-wise.
You're a licensed professional, and you are still figuring this one out,
I'm
right?
still figuring out. I'm still going to meetings that the different insurance companies are putting on. Outside of covered California, I don't know of many companies that already have announced their rates to us. We're still learning every day about the plans. So we still have a lot of work to do, which is why I keep saying to people, wait until end of October, beginning of November. There's no rush.
Okay.
If you sign up by December 14th, you're guaranteed a January 1st effective date.
So we'll have you back on December 14th and see how many people signed up. Greg, thank you so
My
much.
pleasure.
We appreciate it.